Good morning everyone, I'm Traya and I will be your presenter for today. Today I will discuss about the risk factors of male and female reproductive cancer and common disease of male and female reproductive system. Risk factors of male and female reproductive cancer. First is the family history. Second is the genes and chromosomes. Third is age, fourth is environmental factors, fifth is geography, sixth is diet, seventh is infections, eighth is inflammatory disorders. Many genetic and environmental factors increase the risk of developing cancer. First is the family history. Some families have a significantly higher risk of developing certain cancers. Sometimes the increased risk is due to a single gene and sometimes it is due to several genes interacting together. Second is the genes and chromosomes. An extra or abnormal chromosome may increase the risk of cancer. For example, people with the most common type of Down syndrome na sila tulo ka chromosome instead of the usual 2 copies of chromosome, which is 21. So, naay possibility na magkaroon sila og 12 to 20 times higher risk of developing acute leukemia. Third is age. Some cancers such as Wilms tumor, retinoblastoma, and neuroblastoma occur almost exclusively in children. Kanina cancers can mag-result og sa pressure gene mutations that are either inherited or that occur during fetal development. However, most other cancers are more common in adults, particularly in older people. Fourth is the environmental factors. Numerous environmental factors increase the risk of developing cancer. Isa na diri ang tobacco. Tobacco smoke contains carcinogens that substantially increase the risk of developing cancers of the lungs, mouth, throat, esophagus, kidneys, and bladder. Isa na pud ang pollutants in the air or water such as asbestos, industrial waste, or cigarette smoke can increase the cancer risk. Many chemicals are known to cause cancer and many others are suspected of doing so. Fifth is geography. The risk of cancer varies according to where people live. Although the reasons for the geographic differences are often complex and poorly understood, this geographic variation in cancer risk is probably multifactorial, combination of genetics, diet, and environment. 6 is diet. Substances consumed in a diet can increase the risk of cancer. For instance, a diet high in unsaturated fat and obesity by itself have been linked to an increase of risk of colon, breast, and possibly prostate cancer. So, ang mga tao na kusog mo inom og alcohol are much higher risk of developing liver cancer, head and neck cancer, and esophageal cancer. A diet high in smoke, especially kanang mga barbecue, so it increases the risk of developing stomach cancer. People who have overweight or obesity have a higher risk of cancer for the breast, lining of the uterus or the endometrium, colon, kidneys, and esophagus. Seventh is the infections. Several viruses are known to cause cancer in humans and several others are suspected of causing cancer. The human papillomavirus or HPV causes genital warts and is also a major cause of several cancer and vulval cancer in women and penile cancer and anal cancer in men. 8 is the inflammatory disorders. Inflammatory disorders often increase the risk of cancer. Such disorders include ulcerative colitis and Crohn's disease, which can result in colon cancer and bile duct cancers of the blood system. Common disease of male and female reproductive system. Let's go first in female reproductive disease. First is the endometriosis, is a disease in which tissue similar to the lining of the uterus grows outside the uterus. Retrograde menstrual flow is the most likely cause of the endometriosis. Some of the tissue shed during the period flows through the fallopian tube into other areas of the body such as the pelvis. Makakos ni og severe pain in the pelvis ug mas taas ang chance na dili ka mabuntis. Usually kaning endometriosis magsugod ni at a person's first menstrual period and lasts until ma-menopause. So mahitabo ni pag ang pareha na tissue kay magline sulod sa uterus, so it will start growing in areas other than the uterine lining. Second is cervical cancer. Cervical cancer is a type of cancer that occurs in the cells of the cervix, the lower part of the uterus that connects to the vagina. Ang kini cervical cancer, it occurs most often in people over age 30. Long-lasting infection with certain types of human papillomavirus or HPV, kaning HPV is mauni ang main cause of cervical cancer. So unsa man ang HPV? So HPV is a common virus that is passed from one person to another during sex. So cancer isn't usually top of mind for young women, but this type caused by the human papillomavirus or HPV is a serious threat. Third is HIV or the human immunodeficiency virus. It's a virus that attacks the body's immune system. So if ang HIV dili dayon madali, it can lead to AIDS. So AIDS mean acquired immunodeficiency syndrome. There is currently no effective cure. So wala pa gihapoy cure ani. Once people get HIV, they have it for life. But with proper medical care, HIV can be controlled, so makontrol siya. People with HIV who get effective HIV treatment can live long, they acquire healthy lives, and protect their partners. With today's powerful medications, this disease can often be managed like a chronic condition. So some people live so well with the virus that they want to have a baby. Fourth is the polycystic ovary syndrome or the PCOS. Polycystic ovary syndrome is a condition in which the ovaries produce an abnormal amount of androgens, male sex hormones that are usually present in women in small amounts. The exact cause of PCOS is unknown. There's evidence that genetics play a role. Several other factors, most importantly obesity, also play a role in causing PCOS. So if higher ang levels of male hormones, it is called androgens. Pagtaas ang androgen levels, it prevents your ovaries from releasing eggs, which causes irregular menstrual cycles. A diagnosis of PCOS doesn't mean you can't get pregnant either naturally or with assisted reproductive treatments, but it can make the journey longer and more difficult. Daghan og mga babae nga wala kabalo na naade sila common cause of infertility until they try to conceive. It's related to a hormone imbalance that affects ovulation. Fifth is gonorrhea and chlamydia. Gonorrhea and chlamydia is sexually transmitted bacterial infection that shares symptoms including painful urination and genital discharge. Chlamydia and gonorrhea are sexually transmitted diseases or the STDs that you can get during vaginal, anal, or oral sex. Ang buntis na babae pwede niya mapasa ang STDs sa iyang baby during birth. So, STDs are also sometimes called STIs, which means sexually transmitted infections. Mao ni ang result of different bacteria overgrowths. Chlamydia and gonorrhea are both extremely common. Untreated ang gonorrhea and chlamydia, makakos ni siya og pelvic inflammatory disease or the PID, mo ni ang magfa-infection sa imuhang reproductive organs. So let's move on to male reproductive disease. First is the erectile dysfunction. So erectile dysfunction or the ED is defined as the inability to have or maintain an erection hard enough for satisfactory sexual intercourse. So it also known as impotence. Mo ni ang difficulty getting and keeping an erection. So it can be an embarrassing thing to talk about. So it's been reported that more than half of men between the ages of 40 and 70 experience some form of erectile dysfunction. So treatable ang erectile dysfunction ug ang treatment can lead to better overall physical and emotional health for nearly every patient as well as improve intimacy for couples. Second is premature ejaculation. Premature ejaculation occurs in men when semen leave the body or ejaculate sooner than wanted during sex. Premature ejaculation is a common sexual complaint, as many as 1 out of 3 people say they have it at some time. Premature ejaculation isn't cause for concern if doesn't happen often. A number of emotional and physical factors can lead to premature ejaculation. Premature ejaculation may not only affect you, it may also affect your partner. Premature ejaculation can cause partners to feel less connected or feel hurt. Third is libido. Libido is a sex drive or the desire for sex, varies dramatically from one person to the next. Libido relates to a person's desire for sexual activity and sex-seeking behavior. So, nagadepende po ni siya sa tawag unsa ilahang preferences and life circumstances. Ang libido is affected by medical conditions, hormone levels, medications, lifestyle and relationship problems. Levels of libido vary from person to person and there is considerable individual variation with libido changing across relationship as well in different social and environmental circumstances. Fourth is the testicular lumps. Most testicular lumps and swellings are caused by benign or the non-cancerous conditions, although occasionally they can be a symptom of testicular cancer. Embarrassment delays many young men testicular swelling seeking medical opinion. Ang testicular swellings mo ni ang magresulta og benign conditions such as cyst or hydrocele. So if nag-enlarge na ang testicle, mao na ni ang early signs sa testicular tumor. Fifth is the prostate disease. So the prostate gland is a male reproductive organ that produces fluids that feed and protect sperm cells. So the three most common forms of prostate disease are inflammation, which is the prostatitis, the non-cancerous enlargement or the BPH, and prostate cancer. The actual cause of prostate enlargement is unknown, so factors linked to aging and changes in the cells of the testicles may have a role in the growth of the gland as well as testosterone levels. So katong mga lalaki nagikuha na ilahang testicle at a young age tungod sa testicular cancer, so kani sila dili na makadevelop og BPH. So, ang symptoms sa prostate disease are first, frequent urge to urinate. Second is need pamubangon o kadaghan during the night to urinate. Third is blood in urine or semen. So, if manghihi na anay sagol dugo. Fourth is pain or burning urination. So, inig manghihi, sakit na siya. So, fifth is painful ejaculation. Sixth is frequent pain or stiffness in lower back, hips, pelvic or rectal area or upper thighs. Seventh is drubbing of urine. Always remember guys that you can reduce your risk of getting cancer by making healthy choices like keeping a healthy weight, avoiding tobacco, limiting the amount of alcohol you drink, and protecting your skin. Cancer is not a death sentence, but rather is a life sentence. It pushes one to live. That would be the end of our reporting. Thank you for listening.